How can technological innovation and sunlight save young lives? In Cameroon, this question has found its answer. The country, already plagued by frequent power outages, has only 200 incubators for 90,000 births per year. A real dilemma for premature babies' survival. But for several years now, Serge Nidjou, a teacher-researcher, has taken up the challenge by literally reinventing the incubator, making it compatible with solar power. In other words, an affordable new incubator adapted to local realities that's seeing great success in neonatal services, particularly in rural areas. Let's take a look. According to the French development agency AFD, there are fewer than 100 incubators for over 7,000 healthcare facilities in Cameroon. This staggering statistic becomes even more critical when considering that 15% of premature newborns in the country don't survive, primarily due to insufficient incubators and unpredictable power outages. It's an additional burden weighing heavily on hospitals already under pressure. Recognizing this crucial challenge for newborn survival, a team of academics and researchers from the University Agency for Innovation has developed interactive neonatal incubators made in Cameroon.
The incubators we received have been truly transformative for us. Working in neonatology, we care for sick infants from 1 to 22 days old. We frequently collaborate with the maternity ward, but previously we couldn't admit premature babies because we lacked incubators. Managing these cases was extremely challenging. These new incubators have made an enormous difference in our ability to provide care.
Already deployed in hospitals across Yaoundé, Bafoussam and Bertoua, this innovation by Serge and his team integrates phototherapy, sensors and camera systems. Medical monitoring information is available to doctors in real time through a mobile application, even allowing remote incubator adjustments. But perhaps most crucially, these incubators feature specialized electronic cards designed to handle the voltage fluctuations and electrical challenges commonly faced in Cameroon.
We envision creating an incubator that's user-friendly and can be maintained locally. We built it ourselves, designing it to run on a minimal solar kit. While any device can technically run on solar power, our breakthrough was optimizing energy consumption. With just one battery and a single solar panel, a very basic, affordable setup, we can keep an incubator running 24 hours a day.
With over 100 units sold across the country, this innovative incubator has garnered multiple prestigious awards since its launch. It first received the President's Special Prize for Innovation in Cameroon in 2018, followed by 2 international recognitions: the AFD Digital Challenge Initiative Prize in France and the Orange Social Entrepreneur Prize for Africa and the Middle East in South Africa. These cost-effective incubators have received overwhelming positive feedback from healthcare professionals. At Hope Clinic, on the outskirts of Bertoua, pediatricians unanimously praise the effectiveness of this life-saving invention.
I vividly remember one of our first cases, a woman with a preeclampsia at 34 weeks of pregnancy. We had to deliver immediately as both mother and baby were in danger due to fetal distress. Thanks to our incubator, we performed the surgery here, placed the baby in the incubator, and after 3 or 4 days of observation, both were discharged in good health. The baby born at 2 kilograms became one of our many success stories.
In the neonatology waiting room sits Maso Sophie, mother of a 2-week and a 1-day-old premature baby who was rushed to this hospital for emergency care. Despite her exhaustion, relief shows on her face as she manages a smile.
When we arrived, the doctors immediately began their work, but it was incredibly challenging. I was carrying twins. The first baby came out successfully, but the second wouldn't come. They almost had to operate. In the end, they didn't, but when the second baby came, he was already gone. The first baby was premature. He's in the incubator now. Thanks to the doctor's work, he's doing well. When he was first born, he wasn't doing well at all. He was barely hanging on. The incubator he was placed in saved his life. It's truly essential equipment.
This life-saving device isn't yet available in all Cameroon's healthcare facilities. At 1.5 million CFA francs, approximately $2,500, it remains out of reach for many facilities without support from Cameroon's Ministry of Public Health. The University Agency for Innovation has ambitious plans to scale up, aiming to establish production workshops for these incubators in at least 20 African countries.